For this submission, I'm going to discuss the legal and ethical considerations when the institution's financial decisions are contrary to the practice or the professional code of ethics. We actually ran into this recently in our office with the whole Obamacare, where we had a patient who was, we just found out she was type 2 diabetic. Her blood sugars were well over 400, A1C was, more than 15, and we were currently getting her set up on an insulin regimen. We had her on a sliding scale as well as increasing her insulin several times a week, dependent on what her numbers were doing, trying to get her down below 200. In the midst of us getting her set up, we found out that she had selected an insurance that we no longer accepted. And due to the financial institution, Sutter Gold had decided that we could not see her, that anybody with that insurance, because it was a sort of Medi-Cal insurance, that we were not allowed to continue her care. However, she couldn't get in to see her next physician for several months because nobody in the area was accepting that insurance. So that left us with a huge dilemma because ethically we couldn't just, abandon her. We couldn't see her because we could not bill her financially. We're not an emergency room department. We don't have to see patients regardless of their situation. And so it left the provider with a huge ethical dilemma as to what he was to do, because there's only so long that he can legally see her and can continue to practice medicine for her without being able to send her for lab work and to see her in the office, to follow her. What he ended up doing was talking to her on the phone, having her test her blood sugars at home, and then just having several phone calls with her to try and get her medication adjusted. We also made several phone calls to different facilities explaining the situation, made sure that we got them medical records as soon as possible. We really did anything that we could to get her to kind of check out to somebody else that could take over her care. But it is something that we run into from time to time, to where financially patient can no longer afford to see us, but medically, they need us. We run into that a lot with the mental health patients, to where, they may end up losing their job due to their, anger issues, or we had one patient who ended up breaking his back, and he lost his job because he could no longer perform the function of that when he ended up just not having insurance for a while because he didn't yet qualify for the Medi-Cal disability. He wasn't able to go to his physical therapy appointments because he couldn't afford the treatment. So we're in the midst of care for this guy who has a broken back, and now he can no longer financially afford to come see us because he lost his job due to that. We ended up writing off a lot of those visits because there was really nothing else we could do. We had to see him. It wasn't a Medi-Cal issue to where, the financial institution had just said, no, we cannot see those patients. So we did see him. We ended up getting him set up for what we have known as our charity care, and the office visits were written off. But it is a very difficult decision when a patient's financial reasons prevents them from coming to see us, whether that be a very large deductible or they lose their insurance for whatever reason, and the doctor has to decide whether they're going to continue prescribing the medication for the patient, even if they haven't seen them for a year or more, which oftentimes they're not comfortable with doing because they don't know that the medication is truly still working, that their blood pressures are still under control, that their cholesterol has not gone, completely out of whack, because they can't afford to check their blood sugar and their cholesterol. And